Hi, everyone. My name is Yaser Elqutub. I am a DO, and I graduated from Texas College of Osteopathic Medicine in Fort Worth, Texas. And I am currently a second-year family medicine resident at UT Southwestern, and I am loving it. Before I begin, I want to give a huge shout out and a special thanks to Doctors Rebecca Erie, Zeba Jetpuri, and Sarah Woods for being my awesome co-authors. If it wasn't for your help, this poster probably wouldn't be here. So thank you so much for all your efforts. The title today is called Why Not OMT? And OMT stands for Osteopathic Manipulative Therapy. The subtitle is Practitioner Exposure to Osteopathic Manipulation Could Lead to More Utilization of OMT. So the goal of today, I want to just briefly give you the background as to why we did this particular study, what the results are. And when I talk about the results, I'll hide my face on this video, and then we'll have a short discussion about what we found. So the question truly is, why not OMT? I don't know about your experience if it's similar to mine, but ever since I've graduated medical school, I found that easily the majority of my patients had no clue what osteopathic manipulation was and its uses. But to my surprise, my fellow allopathic colleagues also didn't have a clue about what OMT was and who should be referred and how to use it. And so that's kind of the background as to that led us to this point. So the purpose of this particular study was we wanted to dive into a physician's prior exposure in their lifetime and see how was that related to their knowledge and their comfort and their interest in OMT. And in particular, what we wanted to focus on was if we provided training in OMT, would that provide a benefit and increase in a physician's knowledge, comfort, and interest in OMT. If you've ever looked into the publications about the effectiveness of OMT, you'll see that there are easily several studies that show that OMT is effective in a handful of pathologies. Most notably, people know OMT for MSK-related pain, and it's extremely applicable and a great alternative to things such as opioids, but its use is also beyond that, such as lymphatic drainage and treating infants. It's great first line for pregnancy-related complications. So its use is there and the studies are there, but ultimately it's still underutilized in the medical community. Our hypothesis was we wanted to essentially explore and see that lifetime exposures to OMT should be associated with, the knowledge and comfort in OMT. The other thing is we wanted to see that practicing academic physicians who underwent a targeted OMT training session should improve in their knowledge, their comfort, and their interest in OMT. So what we did was we took academic faculty physicians here at UT Southwestern, which is a large academic program. We gave them a pre-survey, sent it to them by email, and we took them through a 1-hour course through Zoom, which included training videos. And then immediately afterwards, we gave them a similar survey, so we called the post-survey. And the surveys included a 17-question, which assessed their demographics, their overall knowledge and comfort in OMT, and as well as used the Likert scale. Once we had all the data, we used descriptive statistics to just characterize the survey scores, as well as used bivariate correlations to see if there were any associations between what we found. So I'll go ahead and hide my face and just discuss the results. So first of all, we had 16 total faculty physicians that participated in this study. 15 took the pre-survey and 10 took the post-survey. Unfortunately, 6 only took the pre-survey and 1 only took the post-survey. So in other words, only 9 completed both the pre and post surveys. And so what we did was we included only those who completed the pre and post survey into our analysis. And of those who did both the pre and post, so the number being 9, All of them were MDs, and they all had referred at least one patient to receive OMT in the past. And for our curiosity, we were just wanting to see if those who only took the pre or who only took the post survey, if their answers varied significantly. And it turns out it didn't really vary very much in their responses, but yet we still did not include them. So in terms of just raw data, table 1 shows our demographics on the top, the pre-test on the left and the post-test on the right. We asked for things such as sex, how many years in training. Everybody who participated were all MDs. In the second half of table 1, we wanted to evaluate what the exposures were in their lifetime. So what kind of exposures to OMT they had in the past. So some of those categories included trained with DOs during residency, had previously attended lectures, seen live demonstrations of osteopathic manipulation. Surprisingly, no one had ever attended CME credits for OMT, but other things included watched videos, read articles, or have they themselves had OMT done on them in the past. So here are our pre-test and our post-test values. And everyone had essentially answered yes to referring a patient to OMT in the past, except for one physician who only took the pre-survey. And that physician said the reason being is that they weren't sure of who or how to refer to OMT. So in our table 2, we have our pre and post survey descriptive statistics. Using a Likert scale, we asked, what was their knowledge in the theory and concepts of OMT and their skills in OMT, and it, ranged all the way to their comfort in supervising as well as interest in learning OMT. And so we did the pre-survey, they did their training, and then they took their post-survey afterwards, and you can see the scores here. And table 3 showed the correlation between exposure to OMT in the past and and categories such as knowledge in the theory and concepts of OMT, knowledge in the skills of OMT, and so on and so forth. So similar categories in both tables. So I will reappear and we can have a discussion of what we found. So first, what we found was there was a significant association between a physician's prior exposure to OMT and the physician's knowledge about the practice and the purpose of OMT. And so as we see here, exposure was related to things such as knowledge in the theory and concepts of OMT. There was a significant association. There was also significant association with exposure and the skills of OMT and the documentation of OMT and the effectiveness of OMT. Inversely, what we found was exposure to OMT actually was not significantly associated with the interest in learning OMT or the knowledge in the application of OMT. And then probably the most significant finding, and I thought was really amazing, was there was an increase in the mean of every category assessed after our faculty participated in that 1-hour training course. So as we see in table 2, every score went up in terms of its average. So they clearly improved in their knowledge, comfort, and interest after they took that training session. And one thing just to note that we identified a barrier to one of the practitioners who actually only did the pre-survey, but they had never referred patients to OMT in the past because, like I said, they didn't have the knowledge of who or how to do that. And so I think it's pretty obvious that our limitations in the study was the sample size was too small. So obviously a larger number would make this more significant. But in my final minute, I just want to discuss the conclusions that we had. We showed today that training in OMT can improve a physician's knowledge, comfort, and interest in OMT. So that's very important in the medical field. And also, since we found that exposure is correlated to the knowledge of OMT, it may be that more exposure and more awareness of OMT in the medical field will be the answer to, making OMT better utilized. And lastly, given the evidence to support the use of OMT in various applications, it's my belief that osteopathic curriculum should be taught, if not at least introduced into allopathic curriculum and included in recommendations for first-line treatments and various of things, pathologies. So why not OMT, right? That's basically it That's what I have for today. If you have any questions, please leave a comment below. If not, my contact information is right here on the bottom. Thank you so much for your time, and I hope you have a wonderful rest of your day.